Welcome to Achieving Your Optimal Health. This is, I believe, the seventh webinar in our series. And one thing that I was thinking about this afternoon is, is that as I was coming home from a meeting, I felt cold in Las Vegas. And I looked at the temperature, it was 90 degrees. Now, I was in Connecticut. I lived in Connecticut and then prior to that, Oregon, and went to college in Indiana, all cold places. And in my wildest dreams, I could not have imagined seeing 90 degrees and feeling cold. But here we are in Las Vegas, a situation that I could not have imagined. Now, we're talking about optimal health and achieving our optimal health, creating a goal, and moving toward improving our health. And unimaginable things can occur along that pathway. One is, let's say you've got your diet down, you've got an exercise program, you're seeing a chiropractor, a massage therapist, you've got a naturopathic physician, and so you're getting the support you need, you're doing supplementation, and you just got everything down. Your sleep is down so well, and you feel like, wow, you're getting toward your ideal weight and everything's going great. You set a goal and you feel like you're moving toward your optimal health, and then the unimaginable happens. You're in a car accident, you have an injury, there's a sickness, and that could totally derail you from the best optimal health program imaginable. And so, the unexpected does occur, and we find ourselves in situations we never would have imagined. And that's where our speaker for the day, Sheri Martin, comes in. Because Sheri, when we're dealing with a situation where we need medical help that we had not anticipated, there's a dollar expense that comes with that. And how are we going to make that expense? How are we going to get the help, the medical help we need in order to be healed and move forward with our optimal health plan? That's where Sheri comes in. And Sheri Martin is actually, okay, here we are on the home page of our optimal health program, and we're looking at Sheri Martin's presentation here on affording medical health help on the way to achieving your optimal health. And Sheri Martin has spent 30 years in the health insurance industry, and actually has received, she's so inspired to help people through health issues and help them solve problems that are creating barriers on their way to optimal health, that she's actually attained some health education that she's gonna share with us in a moment. But Sheri has an expertise that we need to understand in order to get beyond those situations where the unexpected occurs and we get derailed from our personal health programs. And so I'd like to introduce Sheri Martin, lifetime health insurance broker in many parts of the United States. I guess you've been back in the Midwest and here in Las Vegas, and so she spans not only 30 years in the industry, but a few different companies and a few different parts of the United States. So definitely prepared to help us with not only the traditional ways of financing and creating a hedge that will protect us at times when we need that finance in order to move ahead with our optimal health, but also, helping us to look at some creative ways you may not have thought of to prepare for the unthinkable. So, Sheri, I'd like to turn this over to you now, and I am going to stop sharing my screen and give the screen back to you. Okay. Okay, Sheri, go ahead and take the screen.
Okay.
Excellent.
Sweet. Okay, so David, I got the two screens. Are you seeing the double screen, the one that has two on it, or just the main one?
I am seeing your screen.
I mean, is it showing properly, I guess is my question.
Yeah, all you need to do now is
Up and
open
down.
your PowerPoint and you are good to go.
Okay. So it looks okay on my end. So I guess I'll assume it's okay on yours as well. Um, well, thank you, everybody. I'm really happy to be here, honored to be here. I have a lot to say. It sounds so funny to hear that, I've been in this industry for 30 years, and it's, I guess, a distinction, dubious distinction. I keep on thinking I'm too young to be this old. But just to give you a little context in what I have to say,
And go ahead and hit your display settings right up at the top of your screen.
Okay.
And then click on swap view.
Is that better?
Awesome. Good.
Okay. So how did I get into this industry? I actually have a bachelor's degree in paralegal studies, and I worked for a couple of law firms in Chicago and was pretty much disillusioned with the legal system altogether. So at one point, I took a job with an insurance guy till I figured out what I really wanted to do. And so I worked with him, and he was a high-level insurance executive. So he put deals together between insurance carriers, reinsurance carriers, third-party administrators, and so on and so forth. And in that capacity, he created a lot of products. So, for instance, like let's say I came up with a product idea, he would be the guy to go out and find a carrier to back it. You might kind of liken it to a headhunter, where you got someone who needs a job and then you got the employer who has the position and this person puts them together. So he did that on a high level insurance in the insurance industry. And I've been working for him for a couple of years, and he told me he wanted me to get my insurance license. And I said, well, I don't think I want to sell insurance. He goes, but I think you'd be good at it. And I said, perhaps you don't understand. I don't want to sell insurance. And he says, you start Monday. So begrudgingly, I got my license and I started writing a few policies on the side. And, I found that I was able to bring value to people by able to help them through their situation. So then a couple of years after that, the same gentleman offered me an opportunity to go into business with him as partners. He was going to finance the deal and my job was to build it. And so in Chicago, we had a wholesale brokerage where we marketed some of the plans he put together as an intermediary to the agent community. So I was not only responsible for the creation of some of these plans, but also training agents on how to sell it and who to sell it for, who it was a good fit for, and so on and so forth. And in that position, I also was really involved in the debate with national health care reform the first time. when the Clintons got into office. So I recorded some radio pieces there. So I sold that business 15 years ago, and then something happened in my personal life, and it kind of put a spin on the work I'd been doing. So that started and what was going on with your health. And lo and behold, my husband and I, we both had osteopenia, which is, a loss of bone density prior to getting it as severe as osteoporosis. And I had a friend who is a nutritionist, and she says, they're going to want to put you on Fosamax. Don't buy that. Go get Bone Up by Jaro, this little thing here, and take that. And my husband was teasing me about me and my voodoo medicine. So I took Bone Up for 6 months, and he took Fosamax. And we went and did our follow-up bone density scans, and mine was now normal and his was the same. So I was really excited about it. I brought my Bone Up in. I'm like, you gotta see what's going on here. This is amazing. And the doctor blew me out of the water. She says, that's impossible. Only Fosamax can take care of that. And I said, well, how do you explain it? She says, well, it must have been a faulty test. And I said, well, they were done back to back in the same facility both times. The only variable is what we took. Well, that unleashed the beast. So I started researching everything I could on it, and I became fascinated with it. This whole concept of our healthcare delivery system. So at that point, I chose to pursue a course of study in natural health. And the first class I took was called The Politics of Cancer. And it was so eye-opening. Basically, what they opened my eyes to is that let me give you a quote here, $1.5 trillion industry, if part of that's fed by some health conditions, big conditions like cancer, diabetes, where there might be other alternatives, or getting to the root cause of the disease. Rather than do that, people didn't want to detract from their livelihoods, let's put it that way. So that kind of opened up my eyes. And then when I went back, as I was working in the health insurance industry, I could see the abuses everywhere. So, and I'll give you another example, like over 60% of medications are plant-based. They isolate the one active ingredient in that plant, and then they put it in a pill, and then they patent it, and everybody makes a lot of money, except, we wonder why our premiums are going up, So let's just kind of give you a little bit of background on that and how I got to be in the situation that I'm in. So while I'm going to go through some of your health plan options with you, there's a certain amount that I need to share with you so that you understand what your options are. But towards the end, I'd like to circle it back around and then show you that based on your needs, your particular needs, might influence your choice of healthcare. So what is insurance? So insurance is basically, it's a practice where a company guarantees compensation for a specified loss in return for a payment of premium. So you might think of this as spreading the risk. And its whole purpose, it's inevitable in life. We're going to have different kinds of financial crises. And in this particular situation, we're talking about medical financial crisis. But it's so that not any one person gets so burdened financially in the event of a medical crisis. Is that kind of protection. The ACA Act, the ACA called Obamacare, Affordable Care Act.
Sheri?
Yeah.
Sure. Just a quick thing. Well, you're freezing, and I'll cut this out of the video when we do the recording. But you're freezing, and I'm wondering if you've got other things open on your computer. Do you have any other programs open that are taking up the memory of your computer and causing it to freeze?
I do not.
You
Yeah.
don't. Okay.
No. Yeah. Sorry.
Okay. Every now and then we lose you,
Well,
but
you can. I'll try to slow it down, and if you can bear with me.
okay. Go ahead.
Yeah.
Continue.
Well, so there were three goals of the Affordable Care Act. First of all, the first goal was to expand access to health insurance. There was a lot of people who couldn't get health insurance because they already had existing medical conditions. There's some counties and some states that were underrepresented with providers. It was also to protect patients against arbitrary actions by insurance companies. And the goal was to reduce cost. Um, and the reality is I haven't really seen that goal met. It seems like basically a lot of the costs have gone up because of the mandates they put in place. But as we go through your options, I can explain what all that means to you. Oops. So, so basically I'm going to talk about three different options of the fully insured marketplace. So some of this will probably be basic, but just in case someone doesn't understand, I'm going to take a couple of minutes on this. So you've got an HMO option, stands for a health maintenance organization. This is really the epitome of managed care. You're going to pick a primary care physician who's going to direct all of your health care. So for instance, if you want to go see a specialist or whatever, you have to have a referral from that doctor. If you stay in network and use their doctors, you can expect a high level of benefit, mostly copay driven. But in the event the doctor you want to see is out of network, there's just no benefits for that. So the HMOs came into existence, with the unions way back when. And I personally think if we think about insurance being a cost share situation, by making everything so like low copay driven, it really encouraged overutilization and therefore contributed to our premiums going up higher and higher. The other option is a PPO, stands for Preferred Provider Organization. Under this model, they also have a network of providers, doctors, hospitals, so forth, that have contracted with the insurance carrier and agreed to take reduced rates to become part of the network. And why do they do this? They do this because it's an exchange. They're expecting more business by being a part of the network than they would if they were on their own. Under this model, you don't have to pick a primary care provider. You've got more options. You can interchangeably go to different doctors of your choosing without needing to obtain a referral. And under this model, there is out-of-network benefits. So that means is if a doctor they want to see is not in network, they can still have that service covered, but they're going to share in much higher costs. Usually the deductible and coinsurance is double, and you're not enjoying a copay in those situations. And if you were to go out of network, there's a hidden exposure, and that is out of network, they're going to pay up to usual, customary, and reasonable for our area. So that means what most of the doctors in our vicinity are going to charge for that service. If the doctor you choose charges more, you're going to be on the hook for that as well. So in my career, I've seen a couple of people get really hurt by that. They think, okay, well, I'm willing to pay double, but their doctors charge so much more. It's almost like they were paying quadruple. So that's just kind of sharing, hopefully somebody will avoid that problem having known about that. Now, you're also going to hear the term HSA plans, and that's really a misnomer. It stands for Health Savings Account. What they really mean, it's an HSA qualified plan. So those plans they're designed differently. They usually don't have any co-pays. You do enjoy negotiated rates, but it's all deductible driven. But if you purchase a plan with that model, it gives you a way that you can put away tax advantage monies into a separate health savings account. And a health savings account is really just, it's similar to your own savings account at your bank. It's just that it's set aside specifically for those purposes. So under that model, the theory is you take the savings by going to that kind of plan and put those monies into your health savings account pre-tax. And then when you go to the doctor, let's say the doctor normally charges $100, he's agreed to take $60 for being part of the network. You pay that $60 out of your HSA account and get a credit towards your deductible. And then the beauty of that is unused funds roll over tax-free year to year, like an IRA. And like an IRA, if I did know a woman who had like $60,000 saved up on it, and she took a Caribbean cruise. At that point, those funds become taxable plus a penalty. But usually the people that like that are looking for more ways to put away money, would rather at least keep it in their own pocket instead of paying it for premium. So it has its niche. And then there's also special needs policies. Sometimes we've got a gap between, let's say a waiting period with your employer. It's a foreign national, can't get coverage any other way. That's another special needs policy. When you travel, you should probably get a separate travel plan. And those tend to be more low cost, but wanted to just touch on them for a moment. So most people get their coverage one of two ways, either through an employer-sponsored group plan or an individual plan. Under the employer-sponsored plans, the employer is going to pay a portion of your premium and possibly the dependents as well. So if someone's got an option to get employer-paid insurance or a group plan, generally you're going to get better benefits and you're going to pay less than if you get an individual plan. But in the event that's not available to you, then there are individual plans that are available. There's an open enrollment period. It's at the end of the year where people can come on, but you can't come on arbitrarily. You either got to come in the open enrollment, otherwise there's a 90-day waiting period. And in Nevada, there's only 2 carriers for individuals. So, and then referencing back to ACA, so it's still, the ACA is still in place. They're just not penalizing people for not having coverage. So I get that question a lot. So when you're making your decision about what kind of health plan you want to go with, you need to think about a couple of things. First of all, what kind of care do you prefer? Personally, because of my background, while the United States tends to still be #1 in trauma care, it's really towards the bottom of the list when it comes to wellness care. So we need high level protection for, those accidents and things like that. This is my personal opinion coming in here now, but I personally like to free up dollars to spend them with providers that are into helping you get your body to a point of homeostasis. So the body has natural healing ability when you do that. So do you feel like you need allopathic care, naturopathic care, functional medicine, which is kind of like, I guess for lack of a better word, I'll call it a hybrid between, it's like a regular MD, but with more of a root cause type of philosophy, or concierge medicine. It's hard to believe today with the insurance premiums as high as they are. Sometimes our system is so overburdened that people still feel like they need to pay additional to get into a practice and they pay extra money so they can get the high level of service that they want. And then,
Could you define those four terms: allopathic, naturopathic, functional, and concierge, just to
um,
let us know
yeah,
what they refer to?
sure. I'll do it to the best of my ability. I mean, they're probably not Wikipedia definitions,
That's
but
fine.
yeah, allopathic's more like what we would consider traditional Western medicine, probably what we all grew up with. The doctor who's, more more about writing a prescription for the symptom. So you got to remember, I come in with a certain bias. So please, when you're listening to me, take that into consideration. And then there's naturopathic care, which is more about getting to the root cause of the disease and treating it from there. A functional medicine, in my understanding, is like kind of a combination of the two worlds. And then concierge medicine is like somebody might pay a membership fee of a couple $100s a month so that they know when they go to the doctor, they're going to get to see their doctor and interact with him for more than the 7.5 minutes that our current healthcare system allots. So,
Okay. Thank you.
yeah, it's hard to think how can someone do a good job for you in 7.5 minutes, So, but those are things just to think about. And then, as you're trying to decide which way to go, and do you need a rich plan or can you just go more catastrophic? You're going to look at your health. Are you just going in for your well woman exam and occasional respiratory infection, things of that nature, or are you a high utilizer? Do you need to go to the doctor a lot and you have a lot of prescription medications that are expensive that you need to have covered? That's going to impact your decision. And then do you need to keep your premium down and understand that you'll share and cost a little bit more, or do you just want to go to the doctor and not think about it and just have a small copay? Or if you're like me and you want to receive more like natural care, then you want to get a plan that's really going to help you get that down, still have your high level protection in case you have your accident or whatever, but free up those extra dollars so that you can go to your natural health provider. So and personally, that's what I chose to do, and I'll show you how I did that in a minute here. So when you're thinking about this, 50 to 70% of most people never even use their health plan throughout the year. And 20% just go in for a sprained ankle or a minor infection and occasional prescription. So only 4 to 7% that are using it a lot for a chronic condition. So if you're looking at the statistics trying to decide where you want to go, as long as you're not dealing with a common condition, you're probably never going to exceed your deductible and co-insurance. So in that case, it doesn't really matter if it's lower or higher, right? Because if you're going to hit your deductible, more than likely you're going to far exceed your out-of-pocket expense. So I mean, on this slide, I'm kind of saying, wow, you'd be tempted to say, well, why even have coverage at all, right? But in the unlikely event you do have your catastrophe, 66.5% of all bankruptcies are tied to medical issues, and 500,000 families file bankruptcy each year because of their medical bills.
Wow.
I know. So what do we do? So this is, I kind of put something together to kind of give you like a ladder you can consider as you're moving up, like trying to figure out what to do. So these first three are government-assisted healthcare plans. So Medicaid is a government health plan that's available to people who cannot afford to pay for their medical care, and it's determined by their annual income. For people that don't qualify for Medicaid but still are having some financial challenges, the government wants to make sure that the children are covered. So they've got a program called Nevada Checkup. And depending on your income, you could qualify for that. And the rates are really low. They're like anywhere from, like, I think it was 25 to 80 a quarter to cover the kids and that qualify for this plan. And I need to mention to you, as an insurance broker, I don't represent either one of these. I can't, it's not even insurance. So I'm just kind of sharing the knowledge, the information. But then, so for people that don't qualify for Medicaid or Nevada Checkup, the next step up would be to go to the insurance exchange. And depending on your income there, you might get help paying your premium. So let's say you had the total premium was $400, you might get a $200 a month subsidy where you're only paying $200 for the coverage versus $400. And this is kind of a guideline. So this 150% column. So as an individual, if you make less than 18,000, you might qualify for Medicaid. If you make between 18 and 48, you can qualify for a subsidy to fund part of your insurance premiums. And how much you get depends on where within that range you fall. Now, they used to go on adjusted gross. I don't sell individual plans anymore, but I don't assume that would be different. But so it was attractive to a lot of sole proprietors or business owners, because like we might have a lot more expenses that impact our income, and so you might fall into that. And then this is on the family size there. So on a family of 8, you could make up to $169,000 and still hope to get a subsidy from the government.
Hey Sheri, what insurance companies can you get insured with through the exchange? Is it like HPN and then that's it, or?
There's HPN. There's one called Silver Summit. And I don't really know. I haven't written one for a while. I don't do individuals anymore. So I'm not sure who's on this year, but yeah, HPN's the only one that seems to consistent.
A lot of them did get out. I remember at first there were maybe 3 or 4. Now there's just maybe 2, and that's it. Ambetter and HPN, Sierra. I think that's just about it. Anthem got off of it.
Yeah, and Sierra and Health Plan of Nevada are really the same company. They're 2 different divisions. One's the HMO and one's the PPO. So there's only 2 carriers in town right now. They're doing fully insured. So I'm saying like off exchange plans for individuals, and it's HPN and Hometown Health. So we don't have a whole lot of options on the individual side.
That's crazy.
It is. It's very sad. And then here's the income levels for the Nevada Checkup. So like if you had, two people in your household, you could make up to $33,000 and get those just discounted rates. But there's different parts. So sometimes I see people, they stay on group plans because they think they're going to get better coverage, and it costs 5 times as much as if they go on a Medicare supplement. And really, when you put the 2 together, it's a lot less expensive than even staying on group insurance. And so I just wanted to mention that that's out there. Now, there's this thing called cost sharing ministries. And first thing I need to say is this is not insurance. It's called a cost sharing ministry. It functions like insurance in the sense that they're kind of spreading the risk, but it's not, because it's a religious organization, it's exempt from the mandates of the ACA that make it so expensive. And as such, they can do a few other things. They can do some medical underwriting. They can put in pre-existing condition limitations could possibly be declined, and maybe some reduced benefits. However, that being said, because they can do that and you do qualify for it, it's a lot less expensive than insurance. The other thing so when I say the reduced benefits, like, so it's got like $1 million cap, the ones I've seen, and the insurance is unlimited. But, having been in the business for so long, when insurance carriers took the limit from 1 million to 5 million, it didn't even hardly affect the rates. So that's how, less likely they were to hit that threshold. So this would be something to think about, like if you're in pretty good health and you want to free up your money to go see your naturopath, like I do, or your myofascial release guy like I do, free up the money for that. I'll give you an example of what that looks like. So for someone my age to get a bronze level insurance policies, we're probably looking around $650 a month. And by bronze level, I'm saying like a $7,000 deductible. And so under the cost sharing ministry, you could get something with $1,000 deductible. You don't have to go to their doctors because they negotiated on the back end, and it's $250 a month. So, when you think about that $400 savings, that's gonna buy me a few supplements and a few myofascial release visits and a few infrared sauna visits and, a visit to my naturopath. So that's kind of where I wanted to circle back around and kind of tell you some of the creative things you can do to get your job done. And, it's just a matter of self-reflecting what you think you need and what you feel most comfortable with. A couple other things here. So it doesn't hurt to ask about cash pay, and I'll give you an example. So recently I had a CAT scan done and I paid cash for it, and it was $120. And if I would have submitted it to my insurance, it probably would have been closer to like $1,000 towards my deductible. So there's like CPL labs are good for the cash pay rate, and then there's let's see, Dr. Carlson probably knows some too, but there's an imaging center. It's right down the street, and right now the name's escaping me, but
I think I've seen the best prices at Desert Radiology. I think Steinberg, like I was just, because you had told me that story about your CT, and I had a client the other day that I was trying to recommend some kind of preventative imaging, and at Steinberg, well, anyway, so it was like a couple $100 at Desert Radiology. So I think they generally have pretty competitive cash rates. And Steinberg is the other big one, but there's probably some smaller ones too.
Yeah, there is one, and it's right now it's escaping my mind, but they had quoted me for an ultrasound, like a couple $100. And when I got in there, I started asking questions. So I was like, well, wait a minute, I'm not in here for that, and that. So when I got in, they just did the ultrasound on the part. It was $16. So this,
SDMI?
I guess. What?
Was it SDMI?
No.
Another one is Simon Med. That's the only other one.
That's it. It was Simon. Yeah, it was Simon. So, just something to put in your back pocket. One thing I've noticed as I've gone through my career here is people don't ask the questions. And if you think about it, like even if we were just going to go buy a new refrigerator, right? We're going to go look at consumer reports. We're going to compare some price shop or, whatever. And the way our systems evolved, it's kind of like we're just giving ourselves away and not, we've got to remember we're consumers too. And, it doesn't hurt to ask a few questions like that.
Mm-hmm. That's very good advice.
Yeah. And I got tons and tons of stories, but, if anything, I just encourage everybody to do that. Then with regard to prescription drugs, There is a program that all Nevadans are entitled to get discounted rates on. It's called Nevada Drug Card. Many times, some doctors will try to prescribe you the newest version of a drug when there's a perfectly acceptable older version. And so you could get it at generic or even at Walmart for a fraction of the cost. So if your doctor prescribes you one of those non-formulary prescriptions with much higher copay, it doesn't hurt to ask that question. And then like financial aid. So if you have a hospital visit and you're on the hook for $7,000, you can go to their financial aid department and see if you can apply for some assistance there. And I've seen a $5,000 bill get reduced to $500 when they were able to produce their financials. So, and so, well, lastly, then, you know, I'm just really a big believer, and we have to be an advocate for our own health. You know, trust your gut sometimes to get second opinions. See what a natural-minded doctor is going to say compared to an allopathic doctor, and you know, I just encourage everybody to get involved in their own health care and their decisions. So, gosh, I could go a whole lot more into any one of these things, but I hope I gave you a big enough overview that you feel like you kind of got to, you know your options better.
This is very helpful, Sheri. Thank you so much. Some of the things that you were sharing were a bit complicated for people who don't live in the insurance world and as you have for the last 30 years. And it's some of these things are very natural to you and to people who may be looking at this video. These things, may be a bit confusing. And so, Sheri, someone might want to give you a call and just say, hey, I'd like to go over some of these options with you and understand them better. One thing that really came home is right near the end of your presentation when you were talking about how we're consumers in most areas of life, but when it comes to insurance, we basically give ourselves away. And we don't shop around. We don't look at what's on the invoice, really. And we end up paying a lot more than we could have because we don't understand the terminology. And that's why you ended up, you got this invoice for between $100 and $200, and you found out that the thing you really needed only was $16. And so I think that's a real theme that we give ourselves away too often, not only when it comes to insurance, but when it comes to our health care. And one way that we give ourselves away when it comes to our health care is that we put that care in the hands of someone else, whether it's our doctor or it's our employer, but we put our health care in the hands of someone else. Tell me what I need to know. What do I need to do next? And if I get into trouble, fix me. That's the whole focus of this series. Achieving your optimal health is about taking control of your own health care, as you show in the last slide. Go ahead.
Yeah, well, I was going to share an example. So, referencing back, I told you about the politics of cancer.
Yes.
So, one of my doctor clients, she went into public health and she took terrible grief from her doctor friends who said, why did you go into public health? There's no money in it. And one of her oncologist friends said, well, chemo is not the best way to treat all cancers, but it's where the money is. And, it was just shocking. It was shocking to hear someone say something like that, So, yeah, just got to make sure you feel good with your provider and be inquisitive and find out the best way to fund it, and really focus on your health, your wellness. Don't go in when you've already got the fire burning. Try to keep it down before it ever catches.
And there are a lot of good and honest providers out there.
There are. I don't want to imply that everybody's like that, but there is a certain element that our best minds, chose that profession as they were called to healing necessarily. And none of this present company included, but they went into it because it made a lot of money. And like I said, I'm not accusing everybody of that. But you just want to make sure that you're with a provider that really does have your best interests at heart.
Yeah, some individuals definitely are not honest, and I heard on the news the other day about a salesperson selling opioids and just celebrating that more people were going to buy the opioids, and they were getting addicted, and wow, this is creating a whole lot more income. So there are some very dishonest people, but I think systems also can become impersonal, and it's not like a particular system, an insurance system, a medical establishment intentionally sought to be dishonest, but it becomes so impersonal. And as you mentioned, doctors have 7 minutes to look at each patient, and they have patients, coming through their system so rapidly. And if you think of anything that you're doing that requires some thought, if you were forced to do that in 1/10 of the time, you'd start making mistakes and you'd miss stuff. And
Right, yeah.
and so there is no substitute for taking control of your own health care and being a very informed person when it comes to both insurance.
Couldn't agree more.
Yeah. Okay. So let's spend a minute or so looking at our own health goals. That's the other part of what we're doing here as a team is we are tracking progress on our health goals and looking at certain issues that we've been facing. And I just want to check in on you guys. Sheri, you mentioned inflammation.
Yeah. Well, Dr. Carlson's been helping me with that.
Okay.
He gave me a suggestion on my diet and what to take. So I've been doing all that. And
Excellent.
I've even gotten to the gym. Shock.
That's good.
Yeah. So, so I'm satisfied so far that, I'm making progress.
Okay, excellent.
It is helpful to come back and know you're going to have to report too. You know what I mean?
Yeah. Well, we just want to be moving in a good direction, and definitely Angela Carlson is able to help with things like diet and preventative things. There's some of our dietary intake can actually create inflammation. She'd be right on top of that. So very, very good. And Gus, how about quality sleep?
Actually, that's improved considerably. I bought a supplement online, just looking at reviews on Amazon, and I picked
really?
something up.
What is that?
Refresh.
Oh,
Right? I did some research as to recommended supplements for sleep, and I found something on Amazon that had it, and oh my God, the impact that it's had.
really?
Yeah,
What's
now
it
I don't
got
wake
in
up.
there?
Well, it has some very key ingredients. I got to take up my magnifying glass for this. It's so small.
That's how the labels are.
Valerian, passion flower, ashwagandha, L-theanine, poppy extract, hops extract, rhodalia, kava, chamomile, lemon balm, melatonin.
Interesting.
Wow.
And the combination, I couldn't believe it. I now don't wake up in the middle of the night.
Wow.
I am now back to REM sleep, so I'm now dreaming. And I get a much better quality of sleep just by taking the supplement. This is like the first time I've taken something that has had, with natural ingredients, that's had such a big impact.
Wow. Well, thanks for sharing that, Gus. And I'm sure there are people who, a lot of people have sleep issues that will they could change their situation just hearing that. Okay, and Denise, yoga practice and postures and gratitude. How are you doing?
Oh, much better. And I've also altered my diet a bit, getting off wheat and soy, and that's helped considerably. Watching those types of foods and things that are in them. So reading the labels and becoming more aware of that. And then also my joints have felt better. So it's probably getting down the inflammation there as well. And my sleep is improved. So yes, I am getting up every morning, doing certain postures, keeping a list of that, and finding that I'm able to go a bit further.
All right. Okay, and let's see. Loya, walking 5 miles, and
Well,
yeah.
actually, I've been moving for the last 7 days,
Okay,
and
that's a lot of
so
walking.
I wear my Fitbit, and so yeah, I've definitely been getting my miles in. That's for sure. And my back's doing a lot better ever since I had that bilateral spinal epidural injections. So I really feel good about it. I feel good about getting my steps in. I'm not consistently doing like 5 miles a day, but I'm getting closer. So that's really good. I'm happy about that.
I think that sometimes what happens is that we have something happen in our lives that gives us the ability, it changes our situation, puts us in a place where we're naturally doing what we intend to do. In this case, you're moving and you're doing a lot of walking just in the course of moving. And I think that's good. It's almost like a gift from the universe, but that's going to come to an end, and maybe you can leverage that. You get a little momentum going through this move, but when that move ends, it'd be a good time to create a regular routine.
Agreed. And actually, our house is much closer to a gym. And so
Awesome.
that's one thing I was just checking out. I wrote down the number for the big gym up the street. And so I'm super excited about that.
Perfect. Good.
Yeah. Thank you, David.
Okay, and Angela, I actually didn't write down an issue that you wanted to work through. So,
yeah, I was thinking that. I mean, I think for me, it's just been trying to be consistent with exercise, and I'm more or less a weekend warrior right now, where I just show up to my hiking group and they lead me up to some mountain. But I am I'm training to hike Mount Charleston, so 2 more weeks.
awesome.
Yeah, so it's a really big deal. I think Mount Charleston, I mean, you would know better than me, is that like 19 miles or something like that? It's been might
Yeah, I
even be,
believe it's the loop is 18 miles, but yeah, by the time you're done, you probably add an extra mile in there somewhere.
yeah. So I think it's 18, 19 miles, and that's definitely more than I've hiked in a very, very long time. So it will be
Wow.
a big accomplishment for me. I declined it last year, and I've been training pretty much every week for the past 3 months, and so that is what's happening with foot pain or no foot pain. I'm going up that mountain. So
When is that going to be? Where you
it's
do
going to
the
be not this Saturday, but the following Saturday.
Okay,
Yeah.
excellent.
Yep. 5 a.m. start time.
Oh my gosh. Okay.
I know.
Well,
Yep. Yeah.
maybe I'll see you up there. Who knows?
Okay, that would be great. Yeah, there's a big group of us. I think there's ultimately, well, I think there's like 13 or 14 of us, but we have a slow group and a fast group, and I am in the slow group.
Okay. Well, I saw Angela up on the Piedmont Ridge above
Yeah.
Red Rock Park.
Yeah.
A few months ago, and just in the middle of nowhere, I'm coming down the trail, and there's Angela.
We literally ran into each other in the middle of nowhere in the
Yes.
mountains of Red Rock, like 8 miles out into middle of nowhere. It's kind of hilarious.
Well, good to seeing you out there.
Yeah, thank you.
That really tends to pull together a lot of health things. You're thinking your
Definitely.
ultimate diet,
Yes.
your
Sleep,
exercise, sleep.
getting it all together. Yep. So these next couple of weeks is just going to be focused on getting my head and my mind and my body all ready to do something really hard. I mean, Gus knows about these kind of things. He's like a marathoner.
Yes.
You know about like the mindset that you need to kind of get into when you're like, oh, this is going to hurt, but I'm going to do it anyway. No pain, no gain, I guess. So,
Yeah, I think we're in David Terry when it comes to hiking up big mountains.
Well, remember the week before, things that you can do are just regular exercise, and then knock off the 1 or 2 days before the actual event, or at least cut it in half. Drink water that whole week before, because the water that you drink before an extreme event, that entire week before, is going to affect your ability more than you can imagine. And then of course the other one is sleep. Get some good sleep, but those things will help prepare you. Make sure you've got good shoes. Don't buy a new pair of shoes or boots and then break them in on that trip, because
right.
believe me, I've done it. I did it with a marathon once. So in so much pain. So
Yeah.
use your
Yep.
favorite.
Yep. Thank you.
Yeah,
Good
yeah,
suggestions.
And I
yeah.
have one suggestion for you, Angela.
Okay.
Use the glutes.
Okay.
Use
That's
the glutes.
good.
They're very
Yeah.
powerful.
Okay. Yeah. I've been. It's really, when you're hiking for 5 hours, you have a lot of opportunity to be like, oh, what is it like if I squeeze this muscle, and what is it like if I step this way, and what if I do that, and it really is. You really do feel a difference when you impact your body in different ways. Because I have chronic pain in my feet, so I'm always evaluating how I'm stepping and what I am doing, and so I have learned some things. I've been exploring that, so that's good advice. Yeah.
Yeah, and I find another thing that's really helpful is when you're going uphill, up a steep hill, do not push with your back leg. Lift your forward moving leg up, and lean slightly forward. That way, it almost makes the incline disappear. So just a thought there. Okay. Well, you'll do great. We want to hear a report on this too.
Yeah,
Okay.
that's a big deal, Mount Charleston.
Yeah, it is. It'll be big for me.
And my health thing had been energy in the evening, and I don't mean in the past tense, because it still is. But I've noticed an interesting thing. Sometimes it's behavior that will help you out with your issue. And in my case, I find I've got tons of energy right now while I'm on this webinar with you guys. And it's in the evening when I should be falling asleep. But my evenings have been like, oh, I'm watching TV, I watch the news, I'm just sitting and observing, I'm watching a movie, and then pretty soon I'm just totally low energy. So I'm finding when I'm engaged, when I have something that is calling forth my best, that I tend to have higher energy. And so I'm asking myself, why is that? I thought that the issue was something to do with, supplements or not enough sleep or whatever. Those things are important, but sometimes it's just behavior. So anyway, that's a discovery I made regarding low energy. Okay,
So, David, are we going to have a moment for Q&A with Sheri about her topic?
definitely. Go ahead.
Awesome. So, my goal when it comes to health insurance is to have something in place for traumatic care. I have a motorcycle accident, car accident, but besides that is to minimize the cost that I have to pay out so that I have more funds for, me paying a healthcare provider directly, right? Basically, which is your strategy with insurance. I tried the health share and that wasn't an option for me. So barring that, what other route would I have to go with that same goal in mind?
Well, yeah, so now your options have become a lot more limited. Well, it would depend on that chart, on the income chart, you can kind of see where you could fall in and see if you could, it's all based on that, like if you would want to go, to try to go with the exchange or something. But other than that, if you got an opportunity to go on group insurance, I would always probably take that first. And then from there, then go up the hierarchy, right? But yeah, but just on as individual, you don't have many options. And you can't come on until the open enrollment period, or if you do, then they have a 90-day waiting period if you don't have a qualifying event.
And that was the impression I was getting. My best affordable option is the health share. Besides that, I'm looking at conventional options.
Yeah. I would personally love to see like a plan that's like a $25,000 deductible. Just knowing that in case I get hit by a Mack truck, I got that high level stuff, you know what I mean? But underneath all of that, I'd rather just self-fund it myself,
Yes.
But
And
they
that's a
don't have
space.
anything like that right now. So
Right. I like, so Sheri's been helping me with my insurance situation for healthcare coverage. And right now I'm on a temporary,
short-term medical.
short-term medical, right? Very low premium, but it doesn't cover, pre-existing conditions, right? So it's really catastrophic coverage.
Mhm.
And I like it. I love it. It's perfect for me, except I can't do it for longer than 6 months. It's not an option.
Yeah,
Oh, really?
it is. It's a short-term solution. Yeah, it's not really designed for big comprehensive, but it is a good patch for the gap.
And you can only have it for 6 months. Why is that?
Because it is just short-term medical. At the end of that, you could always look to replace it with another short-term medical.
Okay.
But like I said, but then the problem you run into there, so remember they don't cover pre-existing. So if you have, like, let's say in that 6-month period of time you developed a condition or an issue, they're going to cover you through that issue. But now the next 6-month period, now you've got a
Starting
pre-existing.
over.
Yeah, now you would have
Oh
a
my
pre-existing
gosh.
condition. Yeah. So it's
It's
really
like
not.
roulette.
Yeah, it's not designed for a long term.
Yeah. Wow. Okay. But very creative.
Yeah.
I like that ministries option. Can you explain that again? Just explain how a person would access that. Where would they access it? And how would that work?
Okay, well, so again, the ministries, so they're banding together as a group, and what they have in common is it's like a faith-based industry, so to speak. And because of that, they're exempt from the ACA. Religious organizations are exempt. One time I even saw one similar for a sovereign nation. They're exempt, right? So they band together, and since they're exempt from the ACA, they don't have to cover pre-existing. They can medically underwrite and raise your premiums, or they, it's more like how insurance plans used to be.
Mhm.
And even though we don't like all those things, the fact that they can do that then makes it more affordable. So all the bells and whistles the ACA mandated that put into the regular plans are what made them so expensive. So there's several ministry plans out there. The two that and again, I can't sell it, I can't even officially represent them, but the two that I've heard about the most are Christian Healthcare Ministries. So you could Google that. And the other one's Liberty Health Share.
Okay.
And so, yeah, that's how it works.
Interesting.
Yeah, and you don't have to use their doctors, but that would be more like what I would consider, just high level coverage, but it frees up significant dollars that you can, like in my case, I want to funnel to my style of medicine that I prefer to receive, like I want to do all the things I can to try to stay off prescription medication. So I want to get to the root cause. And so I see Dr. Carlson and Gus and
Okay.
Yeah, I agree with the affordable option that health shares provide. I was blown out of the water once that was introduced to me. And the thing was, it wasn't obvious. And I've done research, but I never came across it until it was brought to my attention by a chiropractor. And that's when I looked at it. I said, wow, this is really attractive. It's a lower limit, right? So it's not for everyone. It's 1 million. Where if you need a organ transplant, you're at 3 million. If you have, a heart condition and you've run into troubles, you're at 4 million. So it's not for everyone. But if you're in good condition and you are working actively to maintain that, it's a viable option. And also, you have to agree to the Christian statements that each specific health share has, because they do have statements you have to agree to.
Hmm.
So here's something though, like let's say you did have that big $1 million kind of medical crisis going on, like the transplant situation. So more than likely, if you find out you're going to have a transplant, it's not going to like manifest overnight. So like let's say now you need a transplant, then the next open enrollment period you could just hop on and go fully insured again. You see what I'm saying?
Yeah. So there's a way to
or if you got a cancer,
optimize it.
Yeah, or something like that.
Okay. Well,
But,
that's
I'm an insurance agent, and that's the route I chose because I wanted to free up that money to seek the kind of care that I want to receive.
Mm-hmm. So lower premiums, and then you have that money freed up to go
It's
to.
like $400 a month extra that I could spend getting,
Wow.
the kind of care I want.
What is a monthly on that tend to run?
Well, mine is $250
Okay.
a month versus $650.
Wow. Yeah, that's significant.
And it's $1,000 exposure versus a $7,000 exposure.
Wow, that's significant too. Okay.
And
Considerable savings.
And she can choose to see an alternative, like she can see a licensed board certified naturopathic doctor, right? You can see, can you use that with Structura, with Gus's practice?
Well, so I don't know. I've never submitted any claims for any of that. I just use my freed up monies to pay for it. So I don't know. I don't know the answer to that question.
Okay.
Yeah.
I have several other clients that use the Christian one of them, and they get all their stuff reimbursed, their supplements, their labs, their office visits to see me.
No kidding. Do you remember which one it was?
I feel like it's Christian. Is it Christian Ministries? I think that's what it is. But I can confirm. I mean, yeah, she has her whole family. I see her 3 children and her. So it's a big thing for their family.
Yeah,
Wow.
Angela and I were looking at the documentation of what's covered and what's not, and it seems much more flexible than conventional insurance. Like as long as a conventional physician makes a diagnosis, uh, as long as a naturopath is providing an effective alternative to that issue, they'll cover it, which I thought was pretty
Well,
impressive.
yeah, and I mean, and honestly, I think the industry misses the boat. But I think they should be more focused on wellness. Um,
Yes, prevention.
versus, yeah, prevention instead of just treating the symptoms of disease. But
Well, for
nobody.
so many years, that's what
Well,
they
as
said,
a,
wellness, 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 but they never come through with it.
Hmm.
It
well,
never happens with the conventional. They get too caught up in being all reactive.
Well,
yeah,
another thing is if you're watching the debates, the political debates on TV, a lot of people are bringing up the idea that insurance companies exist in order to make money and to deny your claims in order to make money. And I'm wondering if the Christian Ministries insurance maybe has a different attitude. I don't know, but I'm just wondering.
I'm sure that they don't have as much, as much collateral with the pharmaceutical industry, and that costs are probably lower, since one of the arguments in the healthcare debate is that it's going to cost a lot more money, and one of the counter arguments is, well, if we take away all the red tape, and we have this kind of expression when you're like a sole proprietor medical professional, where you're like, okay, if I take insurance, I now have to hire somebody and pay them $40,000 a year just to file my insurance claims, because of all the bureaucracy and the white tape and how difficult they make it, which is an intentional, in my opinion, an intentional creation to give more justification to deny your claims. So I think if you have a company like perhaps one of these faith-based ministries they don't have quite that same bureaucracy built into them, so things are less expensive, and then they can pass it on to us. I don't know exactly how it works, but that would be one of the things that I suspect.
Well, I
well,
think
tell
that
you something
perspective is
kind of
important. Go ahead.
shocking. So, in all my years, I only needed my insurance 1 year, and that year it was like $250,000 claim,
Wow.
and the room and board for my hospital stay was $150,000. Well,
Oh.
once it went through insurance, they wrote off $110,000.
Mhm.
So to me, my point is if you can do the job for 40, why don't you just charge 40, and we don't have half these problems.
Mhm.
And then another thing I wanted to share with you one time. So one of my doctors wanted to prescribe a medication for an off-label use, so it wasn't going to be covered. So, and it was $800.
Wow.
So I said, well, can I get this in Canada? He goes, well, legally I can't talk to you about it, but wink, I'm going to have Ashley come in and talk to you. So Ashley comes in with an 800 number on a post-it note for a Canadian pharmacy, and I had it filled there and sent here, and it was like $200.
Wow.
I know. It's just, yeah.
Well, this is a big issue that you're speaking on tonight, Sheri, and this issue may actually decide the next presidential candidate. I mean, who becomes president, because it's so prevalent in our country, and people are struggling so much with this issue.
It's
And
been an issue for 30 years I've been in this business.
yep.
It's always been an issue.
Yeah, but it seems like a crisis now.
It is. So, well, seems like a crisis to me because now I'm getting older and needing it more.
That's good.
I think the reality is that more people are going bankrupt. I think that's the genuine reality, is that people they have bad credit. They're not able to buy homes. They're losing their jobs. They're losing their insurance. You have, like I saw somebody yesterday that he said that his out of pocket for a birth of his new baby is $20,000. You
So,
know, I mean, I think that it's like, I think we're sicker and our healthcare is becoming more and more expensive, and more people are losing their livelihood because they're either afraid to go to the doctor, or they're literally bankrupt. Like I have a friend, I know we're like wrapping up, but I have a friend, a very close friend, that has a lawsuit. A hospital sued him because he didn't pay a medical bill. And he
mm,
is 40 years old, and he's probably going to, this is a particular credit agency in Southern Oregon that is known to be really, really, really aggressive. And probably what's going to happen is he's already got bankruptcy lawyer. This is $7,000. It's a $7,000 bill. Like, this is nothing. That is a drop of, that is nothing. And he is either, he's got bankruptcy lawyers calling him, pressuring him to declare bankruptcy, or he's got this court case against him where he's going to have a judgment, and then he'll have difficulties finding buying a home, and he'll have to be dealing with that for the next however many years if that's on his record, because of a $7,000 ER bill that he had, and he's now on Oregon Health Plan, which is Medicaid, you know. And so I really think that the reason why things are in the situation that they are right now is because people are uninsured, and they're sicker, and they're losing money, and secondly, because hospitals are literally bankrupting people. Like people are declaring bankruptcy, and we're in a huge crisis. And I feel so passionate about this, and I think that I'm glad we're here. I'm glad we're talking about this, and get kind of fired up at this time of night. You know, this is the worst thing for all of our sleep, you know, talking about these issues at 8:20.
right.
Just putting that out there. But yeah, that's my 10 cents on why I think we're in more of a problem than ever.
Yes.
So thanks for listening.
Yeah, and from your perspective, working with patients, I can see where you're on the front line and you experience a lot of that firsthand.
And I
Okay.
like to add
Yeah.
something to that.
Okay.
For healthcare on a cash pay basis, like what Angela and I are doing, it is so liberating, right?
Mm,
Because it's almost like it's a conflict of interest to be dealing with insurance companies, because their focus is not health but to reduce cost,
mm-hmm,
which can impact therapy itself, right?
mm-hmm,
When the client pays cash, our concern is only one thing: the client, their health, right?
mm-hmm.
It's very liberating, very pure. Where if we had to do insurance, it's a different ball game.
Yeah,
Well,
I couldn't
I
agree
didn't
more,
say
Gus.
much, but I, was in practice for over 25 years, and that's what I had to deal with all the time. So
Yeah, I mean,
I saw the good, the bad, and the ugly of it.
Mm,
I feel compassionate for the consumer, you know, the patient, the client,
Yeah.
whatever we want to say, because, you know, especially as Sheri said, that sometimes they're paying $500-600 for this insurance, and they really feel, I want to use my insurance, and I feel like that's part of how things are broken, you know, because it's
mm,
like, well, on one hand, like, if you want to use your insurance for a primary care like service, you know, and what I mean, that's a bad way to say it, but just run-of-the-mill everyday medicine, you know, not like a surgery or a procedure or something like that. Like the insurance company doesn't have your best interest at heart, you
no.
know. So we have this conundrum of where people want to use their insurance, and then they I'm sure Gus experiences this, and Denise as well, but it's like, when they're like, well, why don't you take insurance? It's like, well, if I took insurance, I wouldn't be able to help you. You know, I wouldn't be able to do my job the way that I do my job. And so I think that's another
Yeah.
basically another point for what Sheri has said, which is like, spend the least amount of money to be protected in case of an emergency, because not being insured and breaking the leg is also what's bankrupting our system, you know. So we've also got that situation. But I think that if you have basically the least amount of dollars that you can spend your money in the ways that you want to, if you want to see an acupuncturist, if you want to see a massage therapist, if you want to go to Weight Watchers, you know, like whatever resonates with you, I think that people really have the right to choose how they want to spend their healthcare dollars,
Mm-hmm.
you know. But spending $600 a month on a bad insurance is difficult, and then expecting the provider to be able to do their job with that plan, you know, because the doctor's not making the money on that. That's why they're pushing surgery, you know. So it's just that it's like the whole thing is broken. And I agree with Gus, and thanks for saying that. And that's why we're cash practices, and that's so that we can really, do healthcare and not the sick care that the insurance companies are basically doing for us right now.
I've had CEOs of companies say, well, I don't want to take that supplement because it's not covered by my insurance. I'd have to spend $30, and with my insurance, it's a $15 prescription. And therefore, the snowball just runs down the hill faster and faster to ill health, It's just something else, I tell you. So, but I just think having these dialogues, opening up the discussion, helps at least build some awareness so people know what's going on. And
No, thank you. This discussion has been very valuable. I think I'm going to preserve this for the video also, so because a number of important things came out.